Causes and interpretations throughout history. To truly understand why amok presents such a challenge in terms of treatment, we must first look at how its meaning and causes have evolved through the centuries. Back in 1516, amok was known as amoko, and it wasn't considered a psychological disorder, but rather a solemn and intentional act, a vow to God. People who engaged in amok did so in a way to seek a reputable death, often after recovering from a serious illness. The violent outburst wasn't viewed as an erratic or uncontrollable behavior. It was a purposeful act, a way of reclaiming agency after a period of suffering. But by 1552, the understanding of amok shifted. No longer was it associated with seeking death after illness, but rather with bravery, particularly in the context of battle. Men were seen as sacrificing themselves honorably in combat, charging into the enemy forces with the belief that their death was both courageous and noble. There was an element of agency here too, but it was now framed as an act of heroism rather than desperation. In 1811, the interpretation of amok took another turn. Now it was seen as a reaction to a personal insult, revenge, or rebellion. People believed that when an individual felt dishonored or oppressed, particularly in a domestic context, they would lash out violently, as if to restore their own sense of loss of power. This interpretation added a psychological layer, emphasizing how social factors like honor and pride could play into the phenomenon. By 1967, amok was officially classified as a cultural bound syndrome, a term used to describe mental health phenomena that are shaped by cultural context. This clinical shift moved amok into the realm of psychological diagnoses, where it could be viewed through a more modern psychiatric lens. And in 2005, the understanding of amok took yet another turn. Now it was seen as a syndrome influenced by rapid social change, especially in societies undergoing significant transformations. People who were struggling to adapt to these shifts might find their coping mechanisms overwhelmed, leading to violent outbursts born out of desperation and a sense of powerlessness. As we trace these changes in perspective, we're left with an important question. Is amok truly a culturally bound syndrome, or does it transcend specific cultural contexts? Could it be that amok is a symptom of a broader societal issue, one that surfaces differently depending on the time and the place? Is it possible that while culture shapes the expression of amok, it's a human phenomenon that can manifest in various ways across different cultures and periods? These evolving interpretations are crucial for understanding why treating amok is so challenging. The causes aren't static, and the treatment approaches have to adapt to these changing ideas. Whether it's viewed through a religious, psychological, or socio-cultural lens, the complexity of amok is a reflection of the complexity of human nature itself. Cultural barriers. Cultural barriers to mental health treatment in Malaysia are a major roadblock. As Raj et al. 2021 point out, it's not about just misdiagnosis. There's also a deep-seated stigma and a strong preference for traditional healing practices that keep people from seeking the help they need. Misunderstandings about mental health run rampant, and this lack of awareness makes it incredibly difficult for many individuals to access proper care. Shockingly, only 20% of people with mental health disorders in Malaysia ever see a mental health professional. Why? Social stigma is a huge factor. In Malay culture, terms like gila, which means crazy or madness, carry a heavy stigma, discouraging anyone from even talking about their struggles. For many, mental health issues aren't even seen as an illness, they're seen as a punishment or even a spiritual possession. And in Chinese Malaysian culture, mental illness is often viewed as a sign of lack of self worth, something linked to personal success, wealth, and family honor. If you don't measure up in these areas, it's believed that you've somehow failed. What's even more crushing is the pressure from Malaysian collectivist society. When someone has a mental health issue, it's not just their problem, it's the family's problem too. That sense of shame can keep people from reaching out for help because they don't want to tarnish their family's reputation. It gets even worse. There's a severe shortage of mental health professionals in Malaysia. In 2018, the country had only 1.27 psychologists per 100,000 people. That's a shockingly low number compared to other nations. On top of that, the healthcare budget for mental health is just 1.3%, far below the 2.4% seen in upper middle class income countries. So not only are these people hesitant to seek help, but the system itself isn't equipped to support them, even if they do. Underlying conditions. Co-occurring mental health disorders and diagnosis complexity. Treating amok is complicated, not only by the violent nature of the behavior itself, but also by the co-occurrence of other mental health conditions, making diagnosis and treatment more challenging. Martin 1999 emphasizes that accurate diagnosis is key to developing effective treatment plans that are tailored to the individual's needs. However, the complexity of diagnosing amok, combined with the multitude of causes behind the violent behavior, means there isn't a one-size-fits-all solution. One of the biggest hurdles is that there is no medication specifically designed to target violent behavior directly. In fact, developing such a medication is unlikely due to its wide range of underlying causes for violent outbursts. That being said, Martin explains that certain psychiatric conditions that often accompany violent outbursts, such as depression, can be treated with existing therapies and medication. For example, depression, which is a common trigger for violent behavior, can be managed effectively through a combination of psychotherapy and antidepressants. In fact, antidepressants have been shown to alleviate depressive symptoms in around 85% of those cases. Given the dangerous nature of amok, Martin points out that selective serotonin reuptake inhibitors are frequently considered the first line of treatment. Why? Because they respond quickly, and serotonin depletion is a key factor in violent and suicidal behavior. By increasing serotonin levels, SSRIs can help reduce violent tendencies. But the treatment doesn't stop there. Combining medication with psychotherapy is critical, not only for managing symptoms, but also for offering a broader support network. This is particularly important in collective cultures like that of Malaysia, where families' involvement is essential. Even outside of culturally specific cases like amok, the presence of community support has been shown to positively impact a patient's well being. When talking about treatment, it's also important to talk about hospitalization and when is it necessary. In some cases, outpatient care may not be sufficient. For patients exhibiting psychosis, violent tendencies, or suicidal behavior, hospitalization may be necessary to protect both the individuals and those around them. Martin emphasizes that hospitalization allows clinicians to closely monitor the patient's condition while medications such as antidepressants begin to take effect. This approach ensures that patients are kept safe while their treatment regime is fine tuned. Tailoring treatment for specific conditions. The treatment approach for amok depends on the underlying condition. For example, if psychosis is involved, antipsychotic medications are crucial. These medications help reduce symptoms such as hallucinations, mania, and delusions, which are all common in conditions like schizophrenia or delusional disorders. However, as Martin explains, antipsychotics are less effective in managing violent behavior that stems from non psychotic conditions, such as antisocial personality disorder or borderline personality disorder. For these conditions, other pharmacological options are more appropriate. For instance, anticonvulsants like carbamazepine and valproate may help manage violence related to mania, while mood stabilizers like lithium are proven to be effective for individuals experiencing mania or bipolar disorder. In these cases, hospitalization may still be necessary, particularly when the patient poses a risk to themselves or others. Treating amok and other violent behaviors is rarely a straightforward process. It requires a multifaceted approach that's tailored to the individual's specific needs and underlying conditions. While medications like SSRIs, antipsychotics, and anticonvulsants can help manage symptoms, psychotherapy, cultural competency, and strong family or community support plays a critical role in the healing process. And in some cases, hospitalization may be the most effective way to ensure the safety and stability during the treatment journey. So, what are these strategies for effective treatment and prevention of amok? As we dive deeper into the complexities of treating amok, we face a crucial question. How can clinicians effectively identify the root causes of violent behavior and develop treatment plans that truly meet the unique needs of each individual? We note that amok, while presenting in various cultures, has a wide range of underlying causes. But here's the kicker. While its symptoms may look similar across borders, the context in which it happens can vary dramatically. So, what does that mean for treatment? Wabalara emphasizes the importance of understanding that while amok may appear globally, its presentation and manifestation are often shaped deeply by ingrained cultural beliefs and attitudes. The key here is not changing the diagnosis, but enhancing the treatment by recognizing the cultural nuances. By considering cultural factors, clinicians can develop more effective, culturally sensitive treatment plans that speak to the individual's lived experience. This deeper understanding could pave the way for more effective prevention strategies. Raj et al. 2021 suggests a unique integration of cultural awareness into clinical practices. In Malaysia, for example, incorporating psycho-spiritual therapy could be a game changer. Imagine reinforcing core values like love, courage, truthfulness, hope, sincerity, and solidarity as part of the therapeutic process. These values aren't just ideals, they're powerful, deeply embedded aspects of Malaysian culture that can help reduce stigma and improve mental health outcomes. Rather than imposing Western-centric ideals, Raj et al. 2021 argue that clinicians should work with the patient's cultural beliefs. This culturally attuned approach not only helps the individual reconnect with their sense of self, but also addresses the societal stigma surrounding mental health. After all, when a patient feels seen and understood within their own cultural framework, they're much more likely to engage and stick with the treatment. And here's where the real impact lies. When cultural and clinical practices merge, something incredible happens. A holistic treatment approach that not only is more effective, but also respects and honors the patient's identity. This can be the key to breaking down barriers and empowering individuals to seek help without fear of judgment. Ethical considerations in treating amok. As we delve deep into the complex world of amok, we're reminded that ethical considerations are crucial when developing treatment plans. Amok doesn't just present unique challenges in terms of diagnosis, it requires an ethical framework that ensures treatment is culturally sensitive and respects the individual's dignity. So, how can psychologists navigate these ethical challenges when working with patients exhibiting violent behaviors like amok? The Canadian Psychological Association offers a solid foundation for this process with its principle number one: respect for the dignity of persons and peoples. This principle emphasizes the need for psychologists to establish collaborative, constructive relationships with clients, treating everyone with equal worth. For clinicians treating amok, this means ensuring that each patient's unique identity, cultural, personal, and otherwise, is not only acknowledged but also respected. It's about ensuring that no one feels diminished or judged based on their background or behavior. This approach is essential in a condition like amok, where cultural context plays a significant role. For example, as we've seen, amok is shaped by various cultural beliefs and practices that can deeply influence how patients respond to treatment. By staying open to a patient's cultural story, therapists avoid imposing their own beliefs. Instead, they create a space where the patient's perspective is heard and understood. This approach allows clinicians to navigate cultural differences, which is key to effectively treating and preventing amok related violence. Principle 2, responsible caring, takes this even further, urging psychologists to always prioritize the well being of those they treat. The core idea here is simple: the actions of any healthcare professional must be beneficial to society, or at the very least do no harm. In the case of amok, a condition that often leads to violence and sometimes suicide, this principle becomes crucial. Psychologists must ensure their treatment plan is culturally competent, meaning it respects the patient's cultural beliefs and community values. The idea is not to force Western practices, but to integrate treatment that aligns with the individual's worldview. In cultures with strong community ties like Malaysia, this means involving community leaders, such as spiritual or religious figures, in the treatment process. These leaders hold significant influence in the lives of individuals and can play a crucial role in the healing process. Integrating these figures into therapy sessions not only honors the patient's beliefs, but also strengthens the treatment by offering support from trusted community figures. It's this kind of culturally responsive care that can help break the cycle of violence and restore the individual to a healthier place. But what if the patient is too unwell to rejoin society just yet? Ethical Standard 2.1 speaks directly to this. Psychologists must use sound judgment when determining the most appropriate course of action. Should the patient remain hospitalized for further care or be supported as an outpatient? These are complex decisions that demand careful reflection, particularly when the patient's safety and the safety of the community is at risk. Alongside this, integrity in relationships, Principle 3, reminds psychologists to be transparent and honest and unbiased. It's easy to let personal biases creep into our work, especially when dealing with something as complex as the muck, which can trigger strong emotional responses. Psychologists must therefore regularly check on their own assumptions and values to ensure they're making objective, evidence based decisions. Reflecting on these methods they choose and being open about how their biases might influence their practice is crucial to maintaining trust in the therapeutic relationship. Finally, let's talk about Principle 4, responsibility to society. This principle encourages psychologists to use their expertise to advocate for social structures that benefit everyone in society. When it comes to AMUC, this means more than just individual care. It's about ensuring that the policies, systems, and healthcare practices around mental health are inclusive and culturally competent. Psychologists must strive to make their healthcare system more equitable and open to diverse cultural needs. They also must be prepared to collaborate with the broader community, gathering input from cultural leaders and individuals who can provide valuable insight into how to best approach treatment and prevention. The Psychological Association emphasizes that psychologists must be lifetime learners. They must continue to educate themselves about cultural, historical, and social contexts in which they work. By engaging with local communities and consulting with cultural experts, psychologists can ensure they're offering the most relevant, respectful care possible. This approach to ethical care doesn't just meet the individual's need, but it also promotes a healthier, more inclusive society.